Hi, my name is Mackenzie Copeland. I'm going to be doing my physical examination on my sister Madison, so we'll go ahead and get started. Hi Madison, my name is Mackenzie. I'm going to be your student nurse today. I'm going to be doing a physical examination on you, but first let me go wash my hands. So I would go wash my hands, then I would go ahead and take her height and weight, get her vital signs. I would assess her behavior, her posture, her appearance, everything looks okay. So we'll go ahead and get started. So first I'm going to start with her skin. I'm going to just look at her arm, looking for any discoloration or lesions, any edema in her arm or on her skin. The same with her legs, just checking for discolorations, lesions, edema. And then I'm going to check the temperature. And then I'll do the same with her legs. Okay. Then I will check turgor. So I'm going to pinch your skin a little bit. And I'm going to check for tenting. No tenting, so good. I'm feeling for texture, everything feels okay. Okay. Then I will move on to her hair. So I'm going to, her scalp really. So I'm going to check her scalp to make sure that there's no lesions. I'm moving the hair from the hairline just to check that there's no abnormalities there. Then I'm going to check her nails. So I'm going to check her capillary refill to make sure it's within 3 seconds. So Maddie, if you'll hand me your hands, yeah. And I'm going to pinch her nail beds to make sure they refill within 3 seconds. Good. Then I'm going to go ahead and check her neck just to make sure everything is good. No abnormalities, lesions there. Good. Okay, then I'm going to go ahead and check through her head. So I'm going to check her eyes first. I'm going to check for perla, which is pupils equal, round, react to light, and accommodate. So I'm going to make sure that check the shape, size, and symmetry of her eyes. Make sure that they're equal. They look the same on both. Okay, then I'm going to check that they react to light. So the way I'm going to do that is split it and make sure that the other pupil dilates that does not have the light shown in it. Good. Good. Then I'm going to check for accommodation. So Maddie, I'm going to hold the pen and bring it closer. Watch it without moving your head. Good. Then I'm going to check her ears with my pen light, the external surface of her ears, making sure there's no lesions, anything wrong with her ears. Good. Then I'll go ahead and check her mouth, or have her open her mouth. I'll check her lips, her tongue, her buccal mucosa, and her palate. Just again checking for any lesions, abnormalities, cuts, anything like that. And if I were to be wearing gloves, then I could have actually physically felt her soft and hard palate, but I'm not wearing gloves, so okay. Get this back in. Okay, now I'm going to check her breath sounds. While I'm checking the breath sounds, I'm going to be listening for any wheezing, crackles, or rhonchi. So I'm going to start with the front, and there's 8 places on the front, so I'm going to start here. I'll start above the clavicle. 1, 2, 3, 4, 5, 6, 7, 8. Then I'm going to check them on each side, 4 on each side. So Maddie, if you can just lift your arms up a little bit. So I'm going to compare on each side. So I'll start here. 1, 2, 3, 4, 5, 6, 7, 8. Good. And if you'll go ahead and stand so I can show the back. Okay. Move that. So when I'm listening in the back, there's 10 spots on the back. I'm going to be listening for any crackles, wheezes, rhonchi, but I'm also going to avoid any bony prominences. So I'll find her spine and her scapula right here. So I'm going to avoid those. So I'll start here. So here's her spine, here's her scapula. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, you can go ahead and sit down. And keep this on. Okay, so next I'm going to check her heart sounds. I'm just going to check for those S1 and S2 sounds and for a regular rhythm. So first I'm going to start with the apical pulse at the apex. The apical pulse is in the 5th intercostal space to the left of the midclavicular line. So I would listen to this for up to a full minute. Then I'm going to listen to the aortic. So that is in the 2nd intercostal space to the right. Then I would listen to the pulmonic, which is also in the 2nd intercostal space but to the left. Then I would listen to Erb's point, which is in the 3rd intercostal space to the left. And this is where you can hear both those S1 and S2 sounds really good. Then I'm going to listen to the tricuspid, which is in the 4th intercostal space, kind of closer to the sternal border. Then I would listen to the mitral, which is in the 5th intercostal space, medial to the midclavicular line. Again, just checking for regular rhythm. Okay, then I'm going to check her pulses. So I'll check your radial pulse at the same time in both arms. Comparing them, making sure that they're the same. I'll check your brachial pulse at the same time in both arms. And then dorsalis pedis on the top of her feet at the same time in both feet. Then I will check her carotid one at a time. Then I will go ahead and auscultate the carotid, listening for any bruit. I'll use the bell of my diaphragm, the bell of my stethoscope. Again, listening to any bruit. We don't want bruit. Okay. And then Madison, if you'll go ahead and lay down so I can check your abdomen. So when I'm checking her abdomen, I will listen for up to 5 minutes in each quadrant. And if I were to not hear anything in either of those quadrants after listening for up to 5 minutes, then I would have someone else come listen to make sure they didn't hear anything before it was declared an ileus. So I'm going to pull her shirt up a little bit. And before I do anything, I'm just going to make sure that everything looks okay. I don't visibly see anything wrong. Then I'm going to auscultate before I palpate so I don't stir up anything and cause any noises that wouldn't typically be there. So here's her belly button. I'm going to listen to the left upper, and then the left lower, right upper, and right lower. Again, up to 5 minutes in each of those quadrants. Then I would go ahead and palpate, feel for any masses, anything abnormal. Okay. All right, and if you can go ahead and stand, Maddie, you can stand up all the way. I'm going to check her gait and posture, and to do that, I'm going to have her just walk from one side of the rug to the other. And okay, that's good. Now we're going to check your range of motion, so stay standing. And so we're going to do the arms first, so you can pronate, supinate, good. You can internally rotate, externally rotate, good. And then you can flex and extend, good. I'm going to do the same thing with her legs. Point it down so you can show it. So flex your legs, and then extend, good. Okay, and then pronate your feet, so stick it up. And supinate, point down, then internally rotate your foot, and then externally rotate it. Really good. Okay. Then I'm going to check the resistance. You can sit down. Her resistance in her arms and legs. So I'm going to push, and I want you to push back. Good. I'm going to do the same thing with her feet. Pushing, and she's able to push back. So that's good. Then we're going to do neuro. So I'm going to have 2 fingers. Maddie, if you could go ahead and squeeze those, sorry, good. Then I'm gonna ask some questions. So Maddie, can you tell me what you had for lunch today?
Pizza.
Pizza. Can you tell me what happened on September 11th, 2001?
The planes crashed into the Twin Towers.
Good. Can you tell me what the phrase "it's raining cats and dogs" means?
It's raining hard.
Okay. And if I were to say a lab is to a dog, what would a Siamese be to?
A cat.
Good. Okay, I'm gonna go ahead and check your facial, that you can move your facial muscles. So can you smile? Can you frown? Can you puff out your cheeks? Good. Okay, I'm going to get something for her to smell real quick. So you can close your eyes. So can you tell me what this smells like?
A cracker.
A cracker. Okay, you can open your eyes. So you go ahead and take a bite out of it and then tell me what it tastes like. And I would also make sure that she's able to swallow, which would check her glossopharyngeal.
A cracker.
It tastes like a cracker. And she's able to swallow it, and so everything looks good there. So I'll also go ahead and have you stand, Maddie. I'm going to do the Romberg test, so you can put your arms on the side, and when I have my hands under her, you can close your eyes. So go ahead and close your eyes. I'm making sure I keep my hands under her, because if she were to fall, I would be able to catch her. Okay, you can sit down. Then I'm just going to check her tendon reflexes. So I'm going to use my stethoscope for that. I'm going to make sure that her feet are dangling. I'm going to check the patellar reflex. So just a little tap. And then the Achilles behind her foot. And then just a little tap there. Okay, Madison, thank you for being my patient today. Miss Beaver, thank you for watching.